Hey there, welcome to ECAPS Watch. I'm Kevin Houlihan, the CEO at Workflow Services, and today I'm excited to be joined by Summer Kerley. She's been a pharmacist for 25 years and worked in the retail setting for about a third of that, but most of her career she's been focused on the managerial side in clinical work and operations, and she's got a deep focus on the role that the pharmacist has in delivering care. So Summer, it's great to see you again. We've known each other for quite a while. I'm excited to have you on the podcast. But speaking of the role that pharmacists has in delivering care, I'm really excited to talk to you about ECAPS because that's what it's all about, expanding the ability for pharmacies to do test to treat. I'm curious for your initial thoughts on how you think about the implication of ECAPS and how you particularly think about how pharmacies can play a role in delivering care in ways that folks might not realize.
Well, thanks. Thanks for having me, Kevin, and it's so good to see you as well. So I'm very passionate about the ECAPS Act for many reasons. Like you had said, I spent the first part of my career working in a community pharmacy in a very rural part of North Carolina. And throughout my career, I have advanced in my career, kind of took a step back in more management with clinical programs and operations. But my goal along the way was to always ensure that the community was taken care of by their pharmacists. And we know that 90% of Americans live within 5 miles of their pharmacy. And if you think about ECAPS, which is focusing on our Medicare beneficiaries, Medicare beneficiaries see their physician. I think a JAMA article said around 13 times per year. I'm sorry, 7 times per year, but their pharmacist 13 times per year. And a lot can happen in that gap. And there are very numerous self-limiting conditions, many being respiratory type infections, that pharmacists are equipped to handle, whether it be through vaccinations, whether it be through testing or treating. So when you think about what did pharmacists learn in pharmacy school? They learned all that. They learned how to provide vaccinations. They're educated on diagnosing as well as treating, especially when it comes to self-limiting diseases. So when you take ECAPS, and yes, it's very, very focused, on influenza, RSV, strep, and COVID, it's a step in the right direction because individuals need access to care. And it's not pharmacists taking away anything from physicians or other providers. It's just being a holistic part of the healthcare team.
And so a lot of that is just you've got patients and customers that are in the store, and they might be doing one thing, but that can have an impact on something else. There's a funny story. I don't think I've shared this with you. Actually, I was in a store in some of our past work together that your teams were managing, and I was watching some customers that were in getting vaccines. And one of the gentlemen in there was in getting a COVID shot at the time, I think. And I heard him hit one side of his phone conversation, and he was calling, I think, his cousin or someone in his family. He's like, hey, I'm down here at the pharmacy, and I just got my shingles shot, and I should really be, do you have yours? You should come on down. I'll be down here. It's not. And so interesting that he came in for one thing and recognized the opportunity to get other kinds of care that would be valuable. And he was on the phone to someone else in his family, encouraging them to come get that kind of preventative care. And so it continues to expand out from just the core service.
Most definitely. And I think that goes back to, to any group or individual that has somewhat of a negative feeling about this, because again, it's not taking anything away from the family care physician or the other providers. It's really finding those gaps in care. And any way we can fill in those gaps as a pharmacist, ensuring that that's one less thing at the next physician's visit that the provider has to worry about or think of when there's more chronic conditions that need to be focused on.
Yeah. And so, I love those kinds of stories about people getting access to more care. And sometimes that means that the pharmacy might be directly able to provide that next kind of care, right, in the case of a shingle shot. But sometimes, to your point, it means that the pharmacy might recognize something and sort of be a catalyst to point the patient in the right direction. Pharmacies are not going to be able to provide all kinds of care. And sort of frustratingly, it changes from state to state. Sometimes they can, sometimes they can't. But they can be a great touch point to what you're saying earlier about Well, you've got a care provider that's interacting with a patient and they might recognize something.
100%. I mean, if you think about a person with diabetes, yes, they're seeing their physician 7 times a year to understand their hemoglobin A1C and what steps are being taken to help control their diabetes. But there's also, for as an example, a whole slew of vaccines that individual needs. So if a physician's focusing a lot of their time on the control of that person's blood glucose, if there are those gaps, such as vaccines, a pharmacist is there to kind of come in and help ensure that that person gets fully vaccinated.
Yeah, we were catching up a little bit beforehand, and you alluded to a story around an experience that you had recently with someone getting some service at a pharmacy, and the maybe it was with you, being able to recognize that maybe there's an opportunity there for something more. Can you share about that?
I can, and it was knowing that we were going to have this conversation. I was thinking about it, and like I said, I've been out of working in a pharmacy for quite a while. But during this respiratory season and my semi-retirement, I have been giving vaccines at some local pharmacies, and I was, had a full schedule with vaccines. I had an individual come in. We were just talking. I had given a flu, I think, and a COVID as well. And in that conversation, it was a female, and she was talking to me about symptoms of a urinary tract infection. And in that moment, and I live in North Carolina, the first thing that came to mind is I really wish I could help this individual, not by a referral, right? Because this is a self-limiting condition. But if North Carolina followed the regulations of Idaho, in which a pharmacist can provide services on self-limiting conditions, I could have taken care of that individual in the moment, not only by closing those immunization gaps to prevent respiratory infections this year, but also helping to treat the self-limiting condition, which really would have been a questionnaire, and then simply, if they met the criteria, prescribing antibiotics for the infection. And so that goes to show I had that person in front of me. Now, the next step, she had planned to go to an urgent care, but what if there wasn't an urgent care available? Would she have went Saturday, Sunday with symptoms, and then having to wait to Monday, then followed up by then coming back for a prescription? So it goes to show there are so many different conditions in which a pharmacist can help the individual in the moment.
Yeah, well, and I just think even beyond that, there's some cases, like it's like you said, if you happen to be in Idaho, you could have maybe helped her avoid a trip to urgent care. But there are going to be things that come up no matter what, where it is too complex, and the next step is to go to urgent care.
Exactly.
But the magical thing I think about that story is that she was there and you were with her at that time, right? And so she's getting care. I'm curious. I have to believe that just having that conversation with you about these other symptoms she has increased her chances of actually going to urgent care and getting it addressed right away, because you're there, you're helping provide care, you're providing some advice. What would have happened if I mean, it's kind of interesting that she feels like she's got these symptoms, she thinks she needs to go to urgent care, but she's coming in for a vaccine anyway. I know some speculation, but just as a single data point that can provide kind of a general picture, to me, that seems like a little bit backwards. That it seems like she should have gone to urgent care first, but is it just that it's so much easier to go to the pharmacy, or do you think she wanted to get your perspective or the pharmacist's perspective?
It's just so much easier to go to the pharmacy, right? I mean, yes, there are a lot of appointment-based services now within a pharmacy, just like vaccines and other services based on the state that can be offered by those pharmacies. But you can always walk in to a pharmacy and speak to your pharmacist,
Yeah.
right? And I think that's where it makes it so much easier for someone, because at least, she heard the advice of, hey, there's some over-the-counter products you can take for the symptoms. It's not going to treat anything, but if you
Yeah.
need to get that, this is what you should get. Hey, I really do think that you do need to see a provider so that you can get a prescription for an antibiotic. And that was an easy conversation because,
Yeah.
myself, the pharmacist, was right there to help.
Yeah. I mean, just having the experience of, folks in my life or, older family members, that kind of thing. I have to believe that her, I don't know, conviction to go get more care was so much higher walking out of the pharmacy versus when she walked in. And to me, that's just the magical thing about it's that touch point, right? There's so much downstream positivity that a patient can gain from having that touch point with a caregiver. And man, that story is just so cool because it shows the role that the pharmacy can play in just identifying things and even just guiding towards the right kind of care. And I think that's a great story because it exposes the role that the pharmacist plays in the whole community of care, right? So that's obviously great for the patient that she's able to get a better understanding about what's going on and what she should do. I think it's good for her care team, her more traditional care team, her doctors and her, because she's coming in sooner, right? I have to imagine that that's an easier situation to treat. We always talk about like, well, who's paying for this all? And the insurance companies, and that's a big part of what ECAPS is about getting Medicare to recognize pharmacists. But it's good for the insurance company, even for their bottom line, to get earlier care for patients. And so you said something a little bit before. It's not about shifting business away from the traditional care team. It's about working together in closer coordination.
Most definitely. And I think that's the goal of all pharmacy associations that are behind ECAPS. It's not about stepping in and taking ownership of the patient. It's really about just being an additional part of the care team that can help guide the patient with their healthcare needs.
Yeah. So I know you've had a ton of experience in the past with kind of the growth of vaccinations happening in pharmacies. I'm curious, based on that, any thoughts you want to share or any kind of broad suggestions you have when ECAPS passes? Are any hopes that you have for the pharmacy industry to make that expansion of care as successful as the expansion of vaccinations in pharmacy?
I think with fingers crossed, everything gets approved with the ECAPS Act, everyone needs to celebrate that win when it happens. But no, there's so much more work to do. Because again, with the ECAPS Act, it covers the testing and treatment and the vaccinations of influenza, RSV, strep, and COVID, if there is a vaccine for, there's not one for strep, but for the others. And that's great, but that's step one, right? Because what needs to happen is that it's covered for Medicare beneficiaries if the state allows. And that's a key component, right?
Yeah.
We've got one win from a federal level, but now all states need to kind of join in and say, yeah, we recognize that, and we're going to ensure that all pharmacists have the regulations in the state in which they practice to ensure that these services are available to these Medicare beneficiaries. And that's one thing with vaccines, that all states are not created equally, right? In what can be offered. The PrEP Act during COVID allowed pharmacists and immunizing technicians to provide flu, COVID, and other ancillary vaccines down to age 3. When that expiration came up, PrEP Act got renewed. It only continued to allow for flu and COVID only, and then kind of took that away from an ancillary vaccine perspective. And the question really is the why behind that. So,
Mhm.
if we think back to COVID in the 2 years in which the majority of the COVID vaccines were given, there's, I think, over 270 million given by pharmacists,
Mm.
over 42 million tests given by
Mhm.
pharmacists. And we know that helped avert over a million deaths, over 8 million hospitalizations. So if something's proven to work and help the general population, why take back any of that authority? And again, I know that focus strictly on ancillary, but when you think about ancillary, that's your pneumococcal vaccine, that's your meningococcal vaccine, that's your shingles vaccine. It's those other vaccines that are so important to help keep the population healthy. So I hope, with ECAPS approval, that it's recognized as step one of many steps needed to help continue to grow the services that pharmacists can provide, where we've already proven the benefit that it has to the general population.
Yeah, I will say I'm optimistic that it is actually a meaningful enough shift that it can make a difference. I mean, it seems in general that state legislation is moving in the right direction
It
in
is,
terms of
most
broadening
definitely,
scope.
and I'm very happy to watch that. And I was very happy how many of the states actually came together with the FDA approval of the latest COVID vaccine, where
Mhm.
there was still a lot of confusion since there with ACIP making their recommendation, but not a CDC director. Many of the states came together and said pharmacists are going to be allowed to give the vaccine down to X age, depending
Mhm.
on that state. But you could see that recognition was there.
Yeah. Yeah. I think it's a great thing. I think like proving it in some cases allows that data to be used for other cases. And so I think it can do two big things. One, it'll encourage more states to kind of adopt those more sensible rules. And then the other thing is I think there will be some good following from some of the commercial payers and the Medicaids also if Medicare is there covering it. So
Most definitely. So
I'm
it's
optimistic.
exciting times.
Yeah, definitely. Well, Summer, thanks for joining. I love the stories that you bring, and it's great to hear
Thank
your
you for having
perspective.
me.
And I love that it's fresh and right now and what's actually happening out there. And love the wisdom that you're able to bring from your experience, but also it's so timely. So thanks for joining on this episode.
Thank you.
It's great to talk to you. And look out for our next episode of ECAPS Watch.